So that's an analysis from the Beta Blockers and Heart Failure Collaborative Group. This is an international group with the support of the leading investigators from all the big beta blocker trials in heart failure and also from the 4 pharmaceutical companies that have given us the original data that these trials were based on. And what we've been able to do is to put those together effectively in a mega trial and have around 18,000 patients worth of data where we can very intricately look at all of these subgroups with enough sample size and enough statistical certainty to do very complex analyses on. So last year we showed that in patients with concomitant atrial fibrillation that beta blockers didn't seem to improve mortality or reduce hospitalization, which was a big contrast to those patients in sinus rhythm. And that generated quite a lot of controversy, and I think what we've done now is to look really focused on those patients in sinus rhythm. So these are mostly patients with heart failure and reduced ejection fraction. Nearly all of those patients had severe left ventricular dysfunction. As I said, they were all in sinus rhythm. And we wanted to know really whether patients who are older, and in particular women, had any difference in the effect of beta blockers. And the reason for doing that is something that's been shown time and time again in clinical practice, that doctors are less likely to give evidence-based therapies to older patients, and in particular older women. And that's something that has been shown in numerous observational trials. We wanted to see whether there was any justification for that. Our main findings were with this huge amount of individual data, and we were able to do an analysis across age as a continuous variable, which has never been done before, is that actually age has no impact on the effect of beta blockers in patients with heart failure and reduced ejection fraction who are also in sinus rhythm. And we saw a similar risk reduction of death in the 50-year-olds compared to the 70-year-olds. And in fact the number needed to treat was around 20 to 25 in all of those age groups, which of course is a very highly effective treatment. The other thing we saw was that the risk of reduction in hospitalization that you get with beta blockers was also similar across age. There was an attenuation as you get older, but even in the oldest age group, which had a median age of 75, they still had a significant reduction in heart failure hospitalization. And that suggests that these drugs should be used across all ages. With respect to gender, we saw very interesting results. So women had a lower overall mortality than men. However, they derived exactly the same benefit in terms of all-cause mortality and also heart failure hospitalization. So really our study was very clear that all patients who've got heart failure with reduced ejection fraction in sinus rhythm, regardless of their age and regardless of their gender, should receive these very life-saving and important therapies. And interestingly, that there wasn't any real difference in the tolerability of therapy. So the older patients were able to tolerate drugs, and in fact the amount of discontinuation was numerically higher for placebo than it was for beta blockers. So even in these older patients, they can tolerate drugs, they can tolerate a good dose of those drugs, and there's no difference in men and women. It's important to stress that these are patients with heart failure. They had reduced ejection fraction and they were in sinus rhythm. But what our data really supports is the current guidelines, which suggest that we shouldn't restrict these patients from getting beta blockers. And unfortunately, that is what happens in clinical practice. We know that from good observational data, and particularly the European registries. And I think it's time that we, as clinicians, really take this on and make sure that all of our patients get these life-saving therapies.